Let's begin by defining what cardiac output is. Cardiac output is the amount of blood pumped by each side of the heart in 1 minute. Remember, it is each side of the heart here. It is measured in liters per minute or milliliters per minute. The equation for cardiac output is the following, where it is equal to heart rate, which is beats per minute, times stroke volume, which is the amount of blood pumped by each ventricle with each contraction, and this is measured in liters per beat or milliliters per beat. In order to maintain cardiac output, you can increase or decrease heart rate and stroke volume. We'll talk about different types of imbalances or conditions that may impact cardiac output and how you're going to maintain homeostasis. But keep in mind, you're going to be regulating heart rate and stroke volume to maintain cardiac output. Let's look at stroke volume in more detail. Stroke volume is actually equal to end diastolic volume minus end systolic volume. So what is end diastolic volume? Remember, diastole is when the muscle is relaxing. In end diastolic volume, what you're looking at here, or what the measurement is the amount of blood that is in the ventricles prior to their contraction. So how much blood do you have in the ventricles right before systole? That's your end diastolic volume. The end systolic volume is the amount of blood remaining in the ventricles after they contract and ejection has occurred. So end systolic volume, the amount of blood that remains in the ventricles after systole. The difference between these two numbers will tell you how much blood was actually ejected. Cardiac output on average is about 5 liters per minute, which is the same as the total volume of your blood. Remember that on average, the total volume of blood in an adult is about 5 liters. Let's look at some factors that influence stroke volume. There are 3 factors. The first one is what we call preload, which is related to the amount of stretch of the ventricular wall. Cardiac muscle cells will contract stronger when they are stretched. This is due to the fact that more myosin heads will be able to bind to the actin molecules. This is called Frank Starling's law of the heart. The amount of stretch is related to how much blood you have in the ventricles. The more blood in the ventricles, the greater the stretch. The amount of blood returning back to the ventricles by way of the veins is called the venous return. If you increase the venous return, therefore you will increase the stretch. And due to Frank Starling's law of the heart, this will increase the strength of the contraction, more blood will be ejected, and therefore stroke volume will go up. Let's look at the second factor that influences stroke volume. This is called afterload. And afterload is the pressure that the ventricles must overcome to open up the semilunar valves. Recall that the semilunar valves open along pressure gradients. So in order for the semilunar valves to open, ventricular pressure has to be greater than the arterial pressure. So this is related to arterial pressure. As arterial pressure goes up, afterload goes up as well. So this is the pressure in the ventricles that you have to create in order to overcome arterial blood pressure to allow the semilunar valves to open. Let's apply this information. The pulmonary trunk artery has a blood pressure of approximately 10 millimeters of mercury. So we measure blood pressure in millimeters of mercury. The aorta artery has a blood pressure of approximately 80 millimeters of mercury. Why is the left ventricular myocardium thicker? Stop the video and try to figure this out. The left ventricular myocardium is thicker due to the fact that the left ventricular pressure has to increase above 80 compared to the right ventricular pressure that must increase above 10 in order to open up the semilunar valves. So the left ventricular myocardium will have more muscle and therefore it will be thicker. What happens to afterload if a patient has hypertension? If a patient has hypertension, afterload will go up. So let's say a patient has a blood pressure in the aorta around 100 millimeters of mercury. That means that the ventricular pressure has to be above 100, not the 80 millimeters of mercury. In order to accomplish this, what do you think will happen to the anatomy of the heart? Think about the ventricular myocardium on the left side. What will happen to it? It will increase in size in order to be able to create greater tension within the ventricles to increase the ventricular pressure to a higher level. Individuals that have chronic hypertension, therefore, will have an enlarged heart. Let's look at the third factor that influences stroke volume, and this is called contractility. Do not confuse contractility with preload. Preload, recall, is related to venous return in the amount of stretch that the ventricular wall experiences. As you stretch the ventricular wall due to increased blood in the ventricles, stroke volume goes up, or the amount of blood that's ejected goes up. Contractility, on the other hand, has to do with intracellular calcium levels. So this is unrelated to venous return or stretch. If you increase the intracellular calcium levels, you will have more calcium binding to the troponin, which will allow more myosin heads to bind with the actin, and this will increase the contraction strength. Inotropic factors are factors that influence contractility. Positive inotropic factors are factors that increase contractility. In other words, these factors are going to increase intracellular calcium levels. The sympathetic nervous system, which is a branch of the autonomic nervous system, will increase intracellular calcium levels. So it is a positive inotropic factor. It's going to increase contractility. Remember that the sympathetic nervous system is the fight or flight branch of your autonomic nervous system. And one of the things that it will do is increase contractility as well as increase heart rate and blood pressure. The neural transmitter released by the sympathetic fibers, the postganglionic sympathetic fibers, is norepinephrine. And norepinephrine will increase calcium permeability, allowing more calcium to move into the cell and therefore increasing intracellular calcium levels. It also increases the release of calcium from the sarcoplasmic reticulum. Other positive inotropic factors include extracellular calcium. If you have more calcium outside of the cell, then that means you can have increased calcium moving into the cell. The hormones norepinephrine and epinephrine will have the same impact as the neural transmitter norepinephrine. Norepinephrine and epinephrine as hormones are released from the adrenal medulla, and the adrenal medulla is part of the adrenal gland. Each kidney has an adrenal gland that sits on top of it. Norepinephrine and epinephrine are released from the adrenal medulla in response to sympathetic input. The difference here is that they will travel in the blood throughout the body, whereas the neural transmitter from the postganglionic sympathetic fiber will go into a synaptic cleft. So it's very limited in where it's going to go, and it doesn't last as long. In addition, the thyroid hormone called thyroxine will also increase contractility. It does this by increasing the number of receptors for norepinephrine on the myocardial cells. Let's look now at some negative inotropic factors, and these are going to be factors that are going to decrease contractility. If increased contractility is due to increased intracellular calcium, anything that's going to block the movement of calcium into the cell will decrease contractility. So calcium channel blockers actually function as negative inotropic factors. And sometimes calcium channel blockers are given to patients that have hypertension or increased blood pressure. Hyperkalemia is increased or elevated levels of potassium in the extracellular fluid. If you have elevated levels of potassium in the extracellular fluid, this will lead to depolarization of the membrane. And the membrane potential, the resting membrane potential, is critical for the function of excitable cells. So if you change the membrane potential, then that's going to influence the ability of the muscle to contract. So hyperkalemia actually decreases contractility. Before we move on, let's just look at this figure that illustrates the autonomic nervous system innervation of the heart. The green lines represent the vagus nerves. These are part of the parasympathetic nervous system. And the gold lines represent the sympathetic fibers. Notice the SA node is innervated by both branches of the autonomic nervous system, whereas the myocardium is innervated only by the sympathetic fibers. So let's look at some factors that are going to influence heart rate. Recall the equation that cardiac output is equal to heart rate times stroke volume. We've already looked at stroke volume, so now we're going to be looking at heart rate. Factors that influence heart rate are called chronotropic factors. Positive chronotropic factors are going to increase heart rate, and negative chronotropic factors will decrease heart rate. The sympathetic nervous system will be a positive chronotropic factor. It's going to increase your heart rate. Again, the neurotransmitter is norepinephrine, and the receptors for the norepinephrine are beta-1 adrenergic receptors. Norepinephrine will increase the heart rate. A second positive chronotropic factor is the atrial reflex. The atrial reflex is a reflex involving the atria of the heart. So when you increase venous return to the atria, you stretch the wall of the atria. And when the right atrial wall is stretched, that will also stretch the SA node. And this will increase the depolarization rate, increasing the heart rate. The purpose of the atrial reflex then is to protect the atria of the heart from being overstretched, which can lead to damage of the atria. Let's continue looking at the autonomic nervous system and its influence on the heart rate. The parasympathetic nervous system is a negative chronotropic factor. In other words, it will decrease your heart rate. The two vagus nerves innervate, recall, the SA node and the AV node. The vagus nerves are your cranial nerves, number 10. The neurotransmitter released by the postganglionic parasympathetic fibers is acetylcholine, and the receptors for the acetylcholine are cholinergic receptors. Acetylcholine will do the opposite of norepinephrine, thus decreasing heart rate. The intrinsic rate of the SA node, recall, is between 80 to 100 beats per minute. So we're going to say 100 beats per minute, and this is what is described in your textbook. However, your resting heart rate is always lower, or should be lower than 100 beats per minute. This is due to the fact that the parasympathetic nervous system regulates your SA and your AV node the majority of the time. The dominant control of the heart rate by the vagus nerves is called the vagal tone. Do you activate the parasympathetic nervous system when your blood pressure is high or low? So think about what the parasympathetic nervous system will do to your heart rate, and therefore what it will do to your cardiac output. Blood pressure is dependent upon the amount of blood in the vessel. As the amount of blood in the vessel goes up, so does blood pressure, and the opposite is true. Therefore, when blood pressure is elevated, the parasympathetic nervous system will fire. This will decrease your heart rate, which will decrease cardiac output, and this will result in a decrease in blood pressure, returning it back to normal. There are some additional chemicals that also influence the heart rate. The hormones epinephrine and norepinephrine will be positive chronotropic factors. they will increase the heart rate in the same way that the neurotransmitter norepinephrine does. Thyroxine, the thyroid hormone, will also increase your heart rate by increasing the number of adrenergic receptors for norepinephrine. So these are going to increase your heart rate. Blood pH will also influence your heart rate. Chemoreceptors located in the aorta and the main arteries feeding the brain monitor the pH of the blood. Recall that pH is related to carbon dioxide levels. As the carbon dioxide levels begin to increase, the pH drops. Eliminating the carbon dioxide from the blood will help return the pH back to normal. Increasing heart rate will allow the blood to return back to the lungs at a quicker rate for gas exchange to occur. Electrolytes will also have an impact on heart rate. This should look familiar. Remember potassium? If you have hyperkalemia, this will decrease heart rate in the same way that it decreases contractility. During bypass surgery, the surgeon can actually use a potassium chloride solution to stop the heart from beating. So they can pour this solution into the thoracic cavity.